Kia ora everyone, this is almost everything you'll need to know about the nerves of the lower limb. Although this diagram looks quite daunting, you'll find that the nerves are actually fairly easy to come to grips with if we take it step at a time. The first issue we have is that the nerves are actually derived in the abdomen and pelvis. The lumbar plexus is formed in the abdomen here, and the sacral plexus is formed in the pelvis, and they're linked by this trunk, which is the lumbosacral trunk. And because your textbook approaches anatomy by regions, the description of the formation of these structures is in those regions, so they're a bit hard to find. However, we can defer learning about the lumbosacral plexus until later and first revise the nerves that we've already come across in our study of the lower limb by compartments, starting with the anterior compartment of the thigh here, which is supplied, of course, by the femoral nerve. So the femoral nerve is derived from the posterior divisions of nerve roots L, 2, 3, and 4, but we'll discuss that later. It emerges either through or alongside the psoas major muscle and passes underneath the inguinal ligament, where it quickly breaks up into branches to supply the muscles of the anterior thigh, including iliacus here, pectineus, sartorius, and the four muscles of the quadriceps femoris group, which are vastus lateralis, rectus femoris, vastus intermedius, which we can't see behind rectus femoris, and vastus medialis. It also has branches to the skin, cutaneous branches to the anterior thigh region, and only one branch that extends into the leg via the subsartorial canal, which is the saphenous nerve, which is an entirely cutaneous branch to the medial part of the leg. Just to note that the psoas major muscle is supplied directly by short branches from the anterior rami of L1, 2, and 3 nerves. We'll turn now to the medial compartment of the thigh, and all the muscles in this compartment and also part of pectineus are supplied by one nerve, the Obturator Nerve. It's also derived from the nerve roots L2, 3, and 4, just like the femoral nerve, except this time it's the anterior divisions of those nerve roots, but more of that anon. The nerve runs from the abdomen into the pelvis and then along the lateral pelvic wall, passes through the obturator membrane, through the obturator canal, I think, and then as it enters the thigh divides into two branches, an anterior branch and a posterior branch. To see the courses of those branches, we'll just remove adductor longus here, because the branches split either side of adductor brevis. The anterior branch continues anterior to adductor brevis, supplies it, and also supplies the gracilis muscle, and then has a cutaneous branch which supplies a small area of skin of the medial thigh. This branch also supplies adductor longus, which isn't here. The posterior branch supplies obturator externus and descends posterior to the adductor brevis muscle and supplies adductor magnus. If we redraw the adductor longus, we can see that it and pectineus tend to obscure the branches of the obturator nerve. Moving now to the posterior compartments, we'll look first in the gluteal region. Hopefully here you'll recognize that this is piriformis, and diligent students will remember that the superior gluteal nerve emerged from superior to piriformis to supply gluteus medius and minimus, and also tensor fascia lata, which may be all the way under here somewhere. Perhaps that's it. And the inferior gluteal nerve emerged from inferior to piriformis to supply gluteus maximus, which has been removed in this image. Another nerve arising from inferior to piriformis supplies the obturator internus muscle and the superior gemellus together. It's called nerve to obturator internus and superior gemellus sometimes. And another small nerve also emerges from the pelvis to supply quadratus femoris and the inferior gemellus. So the two gemelli are supplied by separate nerves. This one is called the nerve to quadratus femoris and inferior gemellus. These nerves are from the sacral plexus, and we'll discuss their nerve root derivations later. Some may also recall that the posterior compartment of the thigh was supplied by the sciatic nerve, which descends from the gluteal region and runs deep to the hamstring muscles and supplies them as it does so. The sciatic nerve is actually the combined anterior and posterior divisions of the L4, 5 and S1, 2, 3 nerve roots. The anterior divisions will form the tibial nerve and the posterior divisions will form the common fibular nerve, and the divisions separate into these two nerves at about the superior limit of the popliteal fossa, the tibial nerve carrying more or less straight on down through the popliteal fossa and the common fibular nerve deviating laterally. The true hamstring, semimembranosus, semitendinosus, and the long head of biceps femoris are supplied by the anterior division of the sciatic nerve, which will become the tibial nerve. The short head of biceps femoris is supplied by the other division, the posterior division, which will become the common fibular nerve. This is one of the reasons that the short head of biceps is not considered to be a true hamstring muscle, because it's supplied by a different nerve, really, and also because it doesn't cross the hip joint, which the other three true hamstring muscles do. This is also the reason why the hamstring part of adductor magnus is called hamstring part, because it is supplied by the anterior division of the sciatic nerve. Another anatomical fascinating fact right there. Moving on to the leg, spoiler alert, the tibial nerve will carry on in the back of the leg to supply all of the posterior compartment muscles, and the common fibular nerve will divide into a superficial and a deep branch, and they will supply the lateral or fibular and anterior or extensor compartments respectively. So the deep fibular nerve will depart from the common fibula and tunnel its way in the anterior compartment, supplying the muscles tibialis anterior, extensor hallucis longus down here, and extensor digitorum longus, and also fibularis tertius way down here, and it remains deep as it enters the foot, and its only cutaneous distribution is between the first and second toes, a small area of skin here, which is very strange, but that's the way of it. The muscles on the dorsum of the foot, extensor hallucis brevis and extensor digitorum brevis, are also supplied by the deep fibular nerve. The superficial fibular nerve descends in the lateral part of the leg and supplies fibularis longus and brevis. It has a much more extensive cutaneous distribution along the lateral part of the leg inferiorly, and also over the dorsum of the foot, either side of the distribution of the deep fibular nerve. So everywhere on the dorsum of the foot except for between the first and second toes. So that leaves us the tibial nerve to supply the entire posterior compartment, both superficial and deep subcompartments. The superficial compartment is supplied by proximal branches that are given off in the popliteal fossa, supplying both heads of gastrocnemius, plantaris, and also supplying popliteus, the proximal muscle of the deep compartment. The nerve then enters the deep compartment by passing through a gap in the tendinous arch of the soleus muscle for the tibial nerve to pass through. It supplies soleus and continues in the deep subcompartment, where it supplies tibialis posterior, flexor digitorum longus, and flexor hallucis longus. Give it two branches. It follows the tendon of flexor hallucis longus more posteriorly than the other tendons and enters the foot, first giving off some cutaneous branches to the medial part of the heel, and then splitting into two plantar nerves, the medial and lateral plantar nerves, which supply all of the skin and all of the muscles of the sole of the foot between them. Clinically, this is very handy, because if you need to make the sole of the foot numb, for example, if there's a penetrating injury that needs exploration or some other reason that analgesia is required, the nerve can be blocked by injecting local anesthetic just medial to the Achilles tendon behind the medial malleolus, which will provide excellent analgesia to the entire sole of the foot. That's where we'll leave this section of the nerves of the lower limb. In the next video we'll discuss the derivation of the nerves, the various nerve roots and the divisions, but we don't need to remember those in detail. We can tackle them in a schematic way, so that's something to look forward to. Until then, I hope this video has been helpful, and ka kite.